Hi, today I'm going to talk about reproductive health risks of girl-child marriage and adolescent motherhood. Anyone who knows me knows this is my passion, so there's too much on these slides. But I'm going to do my best to get through it in 5 minutes, because that's what I told all of you to do. Okay, every year about 14 million girls under the age of 18 marry. Every day, 20,000 girls under age 18 years gives birth in developing countries. The births to adolescent girls these births to adolescent girls predominantly occur in the context of marriage. Sub-Saharan Africa is characterized by the highest rates of adolescent motherhood. South Asia has the greatest numbers. But what is often forgotten is Latin America, and it has the greatest increase in the numbers that we're seeing. The impact on maternal and reproductive health is substantial. 95% of the adolescent births in the developing world occur in girl-child marriage. Adolescent pregnancy causes 23% of the overall burden of disease due to pregnancy and childbirth. 65% of obstetric fistula cases begin in adolescence. And we have seen other studies, and I'm sure more will come after me, that show lower contraception use and less reproductive control in this population. The impact is substantial on their offspring as well, including higher risk for low birth weight infancy and infant and child mortality, as well as child malnutrition. As was just mentioned by Maggie, the issues of social development and opportunity are also greatly compromised, as well as mental health and social support. We've seen from many countries social isolation, restrictions of mobility, suicidality, and this is in no small part because of the intersection of early marriage and young motherhood to a variety of other gender inequities, including gender-based violence. I mentioned before that sexual violence in marriage is disproportionately affecting adolescent brides. Harmful traditional norms such as forced marriage and son preference, differential effects of malnutrition based on sibling composition. So for example, that if there's boys in the household and there's food shortage, the likelihood that the girl will be given the food is greater in this context. Inhibited access to sexual and reproductive health education and care, particularly prior to marriage, but even after marriage for the adolescent wife. And restricted access to healthcare acquisition, not just for themselves, but also for their offspring. So this tells us that social equity indicators are quite important, right? Issues of rural residence, poverty, unequal access to education, unequal access to sexual and reproductive health education in particular, and that has largely driven the interventions of the field to improve access to reproductive health, maternal health, family planning care, and sexual and reproductive health education through existing infrastructures of health clinics and schools. That has been shown to have some effect, but clearly we're not having the kind of gains that we would want at this point. We think that this is in no small part to the fact that the gender and equity indicators occurring prior to marriage, things like coming from a household where there was son preference, from marital violence, coming from a household where there was girl education, coming from a household and moving into households where these issues come at marriage, and even long-term living with the consequences of violence. These are gender inequities that we aren't addressing through the existing infrastructures and really require addressing norms, the value of girls, gender-based violence, and really ending child marriage, which we believe can happen in a single generation. This needs a multi-level, multi-stage approach. We would like to share with you one aspect of one level at one stage, which is pre-marriage with youth, to be integrated into these other issues, into broader streams of work. We did work with rural girls and boys, and we asked them questions on these issues for early marriage, contraception, and gender equity, and we asked the same questions of their parents in order to develop a program for youth empowerment and leadership in the rural areas of Maharashtra. If you look carefully at these slides, what you can see, I just want you to look at the effects on girl-child marriage. These individuals did not think that this was positive, that girl-child marriage was positive. But if you look at the next one, you can look at all of them, but really the next one is on choice of marriage. You see that girls' right to choose who to marry, when to marry, is severely compromised, even by the girls themselves. And contraception value, appropriateness in marriage is also affected. So we broadened our youth care program to really include focus beyond girl-child marriage and focus and prioritize marital choice, spousal violence prevention, and family planning education. And this is what we call the Youth Care Peer-Led Program. And I bring it up because we're going to hear a lot of different programs, but one of the key elements that we want to add to the dialogue is that when girls don't know they have a right to choose, when girls don't know what their choice would be if they were given that right, they cannot voice that choice. And so part of what we want to be moving toward is youth empowerment programs that really emphasize girls' rights to know what their reproductive health is, what their marriage timing and choice can be, and act on those choices in a safe environment. Thank you.